Hi, I'm Rob, an active duty Air Force medic, and I'm going to be teaching you how to properly measure a casualty's oxygen saturation, or SpO2, using pulse oximetry. This is done in the tactical field care phase when you encounter a patient who requires the measurement of oxygen saturation. We'll be discussing the proper technique, different locations for placing the sensor, as well as factors that influence falsely high or inaccurate readings. Ensure that you select the proper body substance isolation, or BSI. Then you want to consider the proper place to place your probe. For an adult, the index, middle, as well as the ring finger can be appropriate. You can also use a toe unless the casualty has diminished circulation to their lower extremities. An earlobe clip as well as a neonatal probe can be used for infants as well as newborns. Then you want to make sure the site is clean and dry. When you place the probe, ensure that the emitter lights are directly opposite of each other. Remember, normal values for a patient is about 95% on room air. On most people, 98% to 100% is normal. Now, some factors that can influence falsely high readings are carbon monoxide as well as certain toxins. Hypovolemia, hypothermia, as well as nail polish can make readings difficult or inaccurate. Make sure that you document the oximetry sensor reading, the location of the sensor, the time, as well as any oxygen delivered if applicable. You want to ensure that you move the probe at least every 2 hours. And finally, this will all be documented on the DD Form 1380.